most people really can't afford to have an unforeseen medical event.
So what sparked the idea to create Ansel?
One of the core observations around Ansel was that
supplemental insurance, how does Ansel simplify it?
First of all, build an insurance product to address this problem. It should cover a wide variety of things.
What's one lesson maybe that you learned founding Ansel?
I think an important lesson for us has been to have a business model that...
How do you and Ansel make it easier for companies with their health insurance administration?
First of all is to reduce complexity. And the biggest way we've done that is...
Hello and welcome to Healthcare Journeys. I am your host, Kevin Rosenquist. Thanks for joining us today. Health benefits have long been a source of frustration for employees and employers alike. Too complex, too costly, and often too inflexible for today's workforce. My guest today is Veer Gidwaney, founder and CEO of Ansel, a company that's flipping the script on traditional health benefits by providing simple, portable, and flexible coverage for the modern worker. Veer, it's so great to have you here. Thanks so much for being on the show.
My pleasure. Thanks for having me, Kevin.
Yeah, I'm definitely interested to talk about this because, health benefits is something that I think is, it's a hot topic. It's kind of always a hot topic, I feel like, but, what in your kind of, experience, why are traditional employer-sponsored plans kind of feeling out of sync with how people work and live today?
I think one of the biggest challenges with employer-sponsored benefits, and in particular health insurance, is really a cost issue. And this is not a new topic, as you pointed out, Kevin. And I think as we've seen healthcare costs get higher year after year, in many ways outstripping inflation, the result of that is that the premiums that most people pay for their health insurance have gone up faster than wages have grown.
Mine is nuts. I'll say that much. For me, my wife, and my son, what we pay for very minimal coverage is kind of like, wow.
Well, I think an important point there too is the minimal element of it, because while the prices have gone up, the quality of the insurance hasn't increased. Right. In fact, it's gone down. And one way to measure that is the extent to which there's out-of-pocket exposure. So, we measure that in more specifically as the deductible. So, in addition to your premiums going up, your deductible is also going up. So the dollars you have to spend before your health insurance actually kicks in and provides coverage has increased, and I think that creates a really real economic challenge for most people, and it's exactly why this is continues to be an important topic for folks around the country.
And we're seeing obviously a rise in freelancers, remote workers, career changers. How does the need for portable, flexible benefits fit into that larger shift?
Yeah, I think that's an important point because when you think of benefits being tied to your employer, if that employer is not a traditional employer in the way that we've thought about it historically, then that creates challenges because, one, you may not benefit from the cost efficiency that comes from being part of a large employer. So there's even added cost burden for folks that need flexible coverage or might be, gig workers. But on top of that, sometimes the quality of that kind of coverage is also not as strong. And so it creates, it presents additional challenges for individuals that are more mobile in the workforce.
Yeah, definitely. And so for you, what sparked the idea to create Ansel? How did your past experiences in healthcare and insurance sort of influence the mission that you have for the company?
Yeah, I've been in health benefits now for about 15 years, and this is the second company that I've been a part of. And the one prior to this was really focused on the overall HR and benefits experience. How do you choose insurance? How do you make sure you're putting together the right benefits for your needs? And through that experience, we're exposed to the kinds of benefits that are being offered to people. And they're identified, I think, a big challenge, which is largely around this issue we've been discussing already, that there's a lot of cost exposure for people, even with employer-sponsored health insurance. And one of the core observations around Ansel was that most people really can't afford to have an unforeseen medical event.
Mhm.
So if you, you mentioned you've got a young child, maybe they play a sport and, God forbid, they twist their ankle on the soccer pitch. All right, well, you might have to go to the hospital, and that could be, hundreds of dollars, if not thousands of dollars of cost. And most people don't have that kind of liquid cash savings available. And
Sure.
so what it creates is a scenario where, it's straining the family budget. In the worst case, it might lead to some form of debt being taken on. I'm always shocked to hear the sheer number of people in America that have medical debt today, but it's above 100 million people,
Mhm.
which is extraordinary in its own right. And that's the problem that we said. Okay, look, there's an issue here. Can we build a financial product, an insurance product that helps address this problem?
Well, I'll tell you right now, it's a million and one because I am one of those people too. I recently, a couple months ago, I fell off a ladder and broke 6 ribs, popped a
Oh,
hole in my lung, and ended up in the hospital for 4 nights. And let me tell you, talk about unforeseen. And I mean, we're doing okay, but that's going to be expensive, So I mean, things pop up out of nowhere, and I mean, I'm obviously glad I had the insurance, but it's still a lot of money out of pocket.
yeah, and the deductible exposure is one element of it, but there are other parts of it too. I mean, you may not be able to work, which could affect wages. You may not be
Yep.
able to care for your child, and that might require paying for someone to help. So there's all these other costs that come with getting sick or having an unforeseen medical event, and dealing with that is, I think, a challenge a lot of people face.
So supplemental insurance, that's something that's often seen as confusing or maybe just secondary. How does Ansel simplify it and make it more accessible for everyday people?
Yeah, that's a great question, Kevin. And supplemental insurance has actually been around for some time. It's not a new kind of product category. But when supplemental insurance was originally created, the problem that existed was quite different. 30 years ago, when these products first surfaced, deductibles were not what they are today, and we hadn't
Mhm.
gone through
Yeah.
30 years of healthcare inflation. And yet, those products have not really evolved in a material way. And there's a lot of things that make them confusing. One is that there's multiple products that can supplement your health plan. So that's problem number one: is how do I choose what I need?
Yeah.
And second of all, is they weren't really designed to cover very much, and as a result, people have experiences that are not positive with their supplemental insurance. You'll often hear stories of, I fell off that ladder, but it didn't pay anything, and I thought it was meant to. And that's largely because those products were not designed to cover very much at all.
Mhm.
And so when we went back to the drawing board, we said, well, the problem has changed. Deductibles are no longer $500; they're $3,000 or $4,000, and the kinds of things that could cost that much money are literally thousands of things that could happen to you. And so if
Right.
we're going to first of all build an insurance product to address this problem, it should cover a wide variety of things. So that's the first thing we did, is we made it really broad. The second thing we did is we made it one product. So, when you go through your open enrollment process and buy your health plan, the idea of picking supplemental insurance should be a singular decision. Can I afford my out of pocket exposure? If the answer is no, buy the supplemental insurance product. The third thing we did, which I think was, probably the most novel, was that we automated the claims experience. And the way that we automated the claims experience was that what we ultimately cover in our plan is tied to the medical plan directly, in that that we cover diagnoses. So what that means is that when you go to the hospital, we'll take your example, Kevin. You fell off a ladder. You broke 6 ribs. You punctured your lung. Those are specifically diagnostic codes. So when you went to the hospital, the doctor said, "Hey, you broke your ribs. This is the diagnostic code for that." We cover 13,000 diagnostic codes. And as a result, our product has no ambiguity on whether it pays a claim. There's no subjectivity to that decision. If you have a diagnosis we cover, we pay that claim. And the way that we automate the payment is that we receive medical claims information from health insurers. And when we receive those medical claims, we pay out our claims proactively. So more often than not, the experience is us reaching out to you, Kevin, saying, "Hey, Kevin, so sorry that you had this medical event. We hope you're doing better. We've sent $1,000 to your Venmo account. I mean, that's in essence the experience. So you're not having to file a claim.
Did you send me $1,000? I don't think I saw it.
If you had Ansel coverage, that's what would happen. And it's created a scenario where, to your question, it's just a much simpler product. It has a very high sort of customer experience value, and we see this in our survey results and our Net Promoter Score.
You're talking about like making things easier. Employers dealing with health insurance administration for employers is a lot of times one of the things that is the most difficult. Is trying to get especially if you have a large staff, if you have a lot of people, opting in. How do you and Ansel make it easier instead of harder for health insurance companies? Or I'm sorry, for companies with their health insurance administration.
Yeah, that's a great question. So first of all is to reduce complexity. And the biggest way we've done that is one product to solve this problem, and automating claims. But there's more to it. Most employers, when they offer up benefits to their employees, they go through an enrollment platform. So you want to be really flexible on how you exist on those enrollment platforms, which we've been able to do in Ansel. But also, movement of information becomes really important. So, are we getting data from that enrollment platform? Are we making it easy for the employer to manage changes on their team without there being a lot of administrative hassle? So those are things that I think are part and parcel of what's expected from employers of insurance companies like ours. And I think we've done what we need to do there to be effective. But while on the one hand, you're right, the challenges that employers face administratively are important, no question. I think the bigger problem, though, is the challenges that their employees face in actually getting this insurance or these benefits to work for them. So, when we designed our company and our product, that was the beginning part of the conversation of, how do we build a really great insurance product that's really easy to use, that pays out benefits fairly? And if we do that well, then other things will flow. And that's largely been the way that it's played out.
Do you feel that employee expectations around healthcare benefits are shifting or changing?
I think they are, but not before going through a stage of cynicism. So I think that if you ask most people, what do they think of their health insurance, you probably won't hear, wow, that's like a really important benefit. I'm grateful to my company that we have great health insurance, and it's been key to my family. I mean, I think most people intuitively know that that's important, but the experience that they've had, or that loved ones have had, or friends have really sort of soured their view of whether these benefits are sort of fair and what they're hoping for. And I think that has created a sort of a view in society that health insurers don't care for you, and I think that's a simplistic response to that challenge. There's a lot more to it, and there's cost baked into our system that causes insurance to be the price that it's at, and we have some pretty fundamental challenges to address there across the sort of system of health and benefits in America. But I do think that the demand has gone up in terms of what we expect. And I think at the very least, what people want is a positive, simple experience, and one in which they're treated respectfully and fairly. And, just putting aside, hey, does my coverage actually cover what I need? But just the experience of it in and of itself should be something that you feel like you're taken care of. And I think, for most people, that's usually the case, but often it isn't. And that's where I think products like ours can make a difference.
Yeah. I mean, I can tell you so far, dealing with the insurance company has not been a bundle of joy for me as I'm going down this road, because it's confused. The website's confusing. The people I talk to a lot of times don't have the right information unless you escalate to somebody else. And it's definitely, the experience is not great out there for a lot of people, I feel like.
Yeah, no, it's not to get overly jargon with you, Kevin, but for folks in the industry, they'll obviously be familiar with the term loss ratio. So, when an insurance company sells a product, they collect premiums, and the claims they pay out are known as a loss ratio. And so the question is, for every dollar of premium I'm paying, how much am I getting back in sort of loss ratio or claims paid? The problem with that phraseology is that a loss is something that you want to minimize. Conceptually, that's the way your mind thinks. And if you put your feet in the shoes of a health insurer or an insurance company, they want to minimize their loss. Now, the problem in insurance, and specifically around health benefits, is that what minimize loss also means is reduce value to the customer. Because the lower the loss ratio is, the lower the value of that insurance product is to the end user.
Sure.
And, so it creates this, I think, underlying approach that does not make it easy to get claims paid, which is just what you described, Kevin, right? You talked about sort of complicated websites, customer service that may not be aware of sort of how this product should work. And I think those are some real challenges, and that causes the distaste that people have.
Mm-hmm.
When we started Ansel, the mission wasn't, how do we build an insurance product that has a really low loss ratio so we can be as profitable as possible. Our approach instead was, how do we build an insurance product that has a highly predictable loss ratio that we aim to hit? And in our view, that's delivering value. And if you deliver value, then more people will want your product. And
Sure.
That feels like a pretty good business to be in.
Sounds like capitalism to me.
That's right. But it's not how insurance is conceptually built. So
yeah.
In our vernacular, we think of it as a value ratio, and we want to deliver as much value as we can to that customer of ours.
Obviously, technology is changing rapidly, maybe now more than ever. Where else do you see technology playing a role in improving how health insurance goes, how keep benefits simpler, smarter, more personalized?
Yeah, I mean, I think not to overly use the importance of data and data being shared effectively, but I do think it's a really important point. So, for instance, just take our product. We could tailor design it more effectively to the consumer if we knew what health insurance they already have. As simple as that may seem, it's not always easy to get that information.
Right.
To take it a step further, just by being able to understand how your health insurance claims have been working allows us to automate claims around Ansel. Now, for 75% of our claims, we can do that, but for a quarter, we can't. And the reason we can't is because we're not able to get the data that would enable us to do it. And that, just sort of goes to the point of, yes, we need to be thoughtful about security. We want to be thoughtful about making sure that data is shared in a way that is respectful to the owners of that information, but not to the degree to which it becomes impractical to use. And so, I think a lot of these challenges are not technologically complicated. They're challenges due to sort of rigidity in policy, rigidity in approach, lack of flexibility to enable a better experience. It's interesting, when we started to design our company, we built our platform and our insurance product at the same time, which sounds intuitive, like why wouldn't you do that? But what it allows you to do, and what most insurance companies don't benefit as a result, because they don't do it in tandem, is it allows you to find these pockets of opportunity to create a much easier experience, which incidentally, more often than not, also leads to a less expensive to manage experience, because
Sure.
Automation is a win-win for us, the insurer, but also for the consumer. But the other side of it too is that insurance product design has a lot to do with the ability to create a better experience. So while technology can help, but technology on top of a poorly designed insurance product is just a slightly better poorly designed insurance product, which ultimately doesn't solve the problem.
Just because you have AI doesn't mean it's going to help. You could be a bad product and have AI.
Exactly.
Right.
And you've said it perfectly. And I think that's where I think it's incumbent upon our industry to just rethink about the insurance products themselves. Are they actually are they good? Are they designed well? Are they simple in how they pay out claims? And I think often the answer to those questions is no.
Mhm.
And it takes a lot of energy for a company to say, "Hey, I'm gonna do this differently," because often that means starting over, and that takes some courage.
Especially in an industry like that, where it's been the same or relatively similar or the same for a very, very long time. Yes, the costs have changed and all that. The system itself, though, it doesn't seem all like it's changed all that much from my side, from my view. As I'm navigating stuff, it seems very similar to the way it was a long time ago.
Yeah, very much so. And I think often the resistance to change is change is hard, and we have all
Expensive.
this we have this expensive, we have this
Yeah.
profitable
Hmm.
product here. How do we want to disrupt that? And sometimes what's also thrown up is that regulators make it hard. What's interesting about that last point is that we're a startup company. We invented a brand new insurance product. The first thought for most people would be, "Wow, that's nuts! You're going to try to convince 50 states to approve this insurance product. I mean, that they've never seen before. They're probably not going to want to do that."
Hmm.
But in fact, the opposite has been the case. And what we found, we're now approved in 45 states. And what we found is that most state regulators have an objective, which is to around insurance regulation, which is to deliver products that are good for their citizens. And if you can demonstrate to them that you've got a product that is good for their citizens, it turns out that they want to work with you
Yeah.
and they're excited to help you bring that to life. So, there's a lot of excuses that can be surfaced on why change is hard, but sometimes you just need to get going. And you'll find that when you share your mission openly, a lot of people already believe in it and want to help out. And that's been our experience.
And healthcare is not the easiest industry to disrupt. Like what's one lesson maybe that you learned along the way founding this company, founding Ansel, in disrupting healthcare and insurance?
I think an important lesson for us has been to have a business model that um, fosters alliances. So, I think that you have to be able to cooperate with other companies. Specifically around health and benefits, there's a distribution model that has a lot of parts to it before it
Mhm.
ultimately gets to the end user, to Kevin, so that we can help him when if he falls off the ladder. Um, but
Well, I'm staying away from ladders, Veer.
that's the moral of the story. So we our model has been to sort of foster those alliances. So as an example, we have a number of other insurance companies we work with who have their own versions of our product that
Mhm.
are on their brand, for which they take on the risk. Their sales teams sell it, but it sits on our platform. And so there's an example of us being able to work with the incumbents and say, here's a way for us to collaborate and go after this opportunity together. So that's just one example that I think has been important to disrupting the space.
We talked before the show that you're a big Edmonton Oiler fan. How likely are they going to make it all the way and again and see if maybe winning the cup this time?
I think it's going to happen. I feel very confident in their abilities to bring it home. Thanks for that question.
Sure, sure, sure. It'd be nice. I'd love for a Canadian team to win it. I think it'd be fun.
It would be.
Yeah, for sure. All right. Well, the company is Ansel Health. Veer Gidwaney, thank you so much for joining me. Really appreciate it.
Thank you, Kevin. Pleasure to be here.